apart to actually help people like change like dynamics and dogmas, right? So we'll start with the idea of, if we're thinking about 100-year lifestyle, right? So think about somebody living over 100 years, right? So if I take 100 different people, 100 centurions, right? I think we would all agree that they're going to have different health problems. They're going to all look different. They're going to move different. They're going to act. Everything's going to be completely different. Some are going to be healthier than others, and some of them are not, right? But when we talk about like the quality of life, like, would anybody not define it by the motor function of your nerves? And then this is how I would define it. And the reason I say that is, at 100 years of life, the speed of firing is going to dictate not only like your balance, coordination, proprioception, your awareness in space, how your body relates, and how you know where you're at all times, but healing inside and out. Like your brain is gonna, if I cut my arm, I don't think about healing. I don't make it heal. The nerves fight, but like it starts actually with the peripheral nerve. The peripheral nerves are gonna pick up the sensation, send a signal back to the brain, and say, hey, there's a problem. We're bleeding. We need to send all the clotting factors to stop this, and then it's going to continue to heal over time, right? We all understand that's your nerves. So your brain and your body communicate. That's the function of your nerves and your central nervous system is your brain and body communication. And then so overall, if we pay attention to these stars, they're going to kind of link everything back together. Better motor function increases the health of an individual, right? So the more we got a 100-year-old person, the more nerve firing and motor function they have, would we all not agree that means they have better health? The more you have, the more nerve flow you have, the healthier you are. The less you have, the less healthier you are. Are we all on the same page with that? We all agree? So then the next thing that I would go into is talking about, in relating this with nerves, nerve facts. Nerves don't regenerate. Your brain, spinal cord, and nerves, your CNS, your central nervous system, is the only system in your entire body that doesn't regenerate. So what that means is, what you're born with, that's it. Your cells, the nerves, they start to grow out. When we think about, y'all want to really think about it, right? The axons, the dendrites, and the axons. The axon is that long part of the nerve. So those things do get longer over time, but you're not going to replace them. When one dies, it's not coming back. So you can regenerate, synaptic communication. Like you can create different, the way that the nerves kind of wire together, you can actually create new, that's called something.
Like neuroplasticity?
Yes, neuroplasticity, yeah. So, but you're still working with the same nerves, but you can create you can regenerate better pathways. Yeah. But when we think about that, right, that means less cells is equivalent to less firing, right? So the more your cells die off over a lifetime, the less communication you get over time. And again, it goes back to all of these things. Balance, coordination, proprioception, healing inside and out, just complete function of your entire body is completely dependent on the nerve firing and the energy that you have within your system, right? So if we have an increase in firing, that increases health, but also vice versa. If we have a decrease in firing, our health diminishes. So over time, over this 100-year life, if our cells of our nervous system continue to die, our health will proportionally decline. Like it's going to be directly linear. Like you can track the numbers, right? Okay, so the next thing that we got to think about is, so understanding all this stuff, when we start getting into what we do, right, or the biomechanics of the spine, would we all agree that an increase in spinal flexibility is going to increase nutrition and hydration to your discs, right? Loss of motion, less health to your discs, right? So increased motion throughout around every single disc, the 23 that we have in our spine, is gonna, it's gonna decrease pain because inflammation is gonna decrease, right? But it's also gonna decrease damage over time, right? Everybody agrees with that? And increased motion is gonna decrease scar tissue. So the scar tissue that as the discs over time, they start to degenerate, they get smaller, more and more scar tissue develops, it stiffens. So if we start to increase the motion to the joint, we start to release and unlock and break up that scar tissue. So And then when we look at an increase in motion, if we increase the joint motion around a disc, and at the same time we decrease scar tissue, how is it not better health and longevity over time? So what I mean is, how is someone's quality of life not directly impacted by doing these things? Increasing motion and decreasing scar tissue. Would everybody agree? Are those two things that we can do? Okay, so just think about that. So one of the stars that I have here is, so nerve health is directly proportional, that's what that arrow is, directly proportional to disc health and preservation, right? And then we take that back to your quality of life is directly proportional to the motor function of your nerves. So the healthier your nerves are, the healthier you are. The healthier your discs are, the healthier your nerves are. Correct? Okay. So the next thing that we'll go into, we'll just go in this direction here. Facts about degenerative disc disease. And this is where, you know, I want you all guys, I don't want to move it because I got the camera, but I want you guys to really like understand this. Like, you should have like a conviction about and a passion about what we do, right? So facts about degenerative disc disease and or DJD, right? I put everyone's gonna get it, right? Question mark, right? But 10% of 10-year-olds are already gonna have signs on an X-ray. 20% of 20-year-olds are gonna have signs on an X-ray. 85% of 35-year-olds are gonna have signs, either clinical signs or on an X-ray and an MRI, and pretty much everybody by the age of 50, right? Okay. So, and degenerative disc disease is not only the number one cause of back surgery, but all surgery. Degenerative disc disease, absolutely the number one cause of all surgery worldwide. Degenerative disc disease is also the number one cause of disability worldwide, okay? And $143 billion just in the United States is spent on disability. And I put 75% in here because 75% of all disability cases is directly linked back to degenerative disc disease, okay? So not only should we have a passion for the health of our patients, but for the quality of our nation, right? I mean, do you think spending that much money, is that spending that much money on something that can be prevented, is that a noble or a patriotic thing to do? Or would inversely it be a noble and a patriotic thing to understand the power that we have and do our part in attacking this as well? So what we do, first understanding this, right, is part of it. So what I'm saying is, not only is this the right thing to do, to understand this and to preach this and teach this and educate our patients, but it's absolutely a patriotic thing to do as an American, right? If you know this. Like, if you have the knowledge and you're just ignoring it, to me it's unpatriotic. Just understanding all this stuff, right? So then we go into the next one, degenerative disc disease, or DJD, the cause, right? So we got progressive scar tissue over time. So what we know is that either repetitive stress, low amplitudes over time of stresses on our disc causes the gradual formation of scar tissue or injuries, you know, major high impact injuries, right? But the disc is also designed for protection and shock absorption. All your discs, they work together. If I jump off that table onto the floor, the weight is supposed to be evenly distributed throughout all of my discs for shock absorption, right? But there's a directly proportional relationship between how much scar tissue you have and, well, it's inversely proportional is what I say, or related, is that the more scar tissue you have, the less shock absorption, the less stress your joints can take. So what that means is, once you start developing scar tissue, the rate of scar tissue formation and the rate of degeneration and the rate of damage to your disc, it skyrockets over time. And there's graphs in there to show y'all that too. And then but the other thing with degenerative disc disease, it increases inflammation over time, so a degenerative disc not only creates a smaller nerve space and less protection around your nerve, less shock absorption, it continually increases inflammation around the nerve, which means, like, if we think about a pinched nerve. A pinched nerve, I mean, the way that we should actually describe it is more like pinching on a nerve, not necessarily a pinched nerve. Because a pinched nerve makes me think of like a physical structure jamming something together. But pinching on a nerve could also be from a damaged disc. When the disc gets smaller, the nerve space gets smaller. You have less protection around that nerve, and then you fill that space with inflammation. Could you not get pinching on the nerve from the inflammation alone, right? So I think that's probably how we should, most doctors should define a pinched nerve as pinching on a nerve, not necessarily a pinched nerve. But, and the other day this clicked to me too. If you think about how a disc, so I didn't mention this, but I mean, I say this all the time. So after we're done growing, all the vascularity to the discs kind of dies off, and it's solely dependent on imbibement. Imbibement is essentially movement and flexibility around the disc. You're going to get fluid exchange between that entire complex. It's going to travel from the in and out of the bone into the disc, and also to the peripheral area, right? But how imbibement works, how circulation and nutrients and hydrate movement, all that stuff in and out of the disc, imbibement is a process of diffusion. So I don't know if we all remember diffusion, but diffusion is the movement of a concentration from higher. It's a higher amount of man. How do we explain this? Pressure. Higher pressure to lower pressure. That's what it is, right? Does a degenerative disc have higher pressure or lower pressure than the surrounding tissue? It has higher pressure, a lot higher pressure. So what does that mean? That means if the disc has more pressure than the surrounding tissue, it's only going to decay. It's only going to have the ability to leak fluid and not absorb fluid, right? So that makes me think back to breaking up scar tissue, because scar tissue decreases our ability to handle stress, so therefore it increases the amount of pressure and stress within the joint, right? And it's okay. So now, any questions on any of this stuff, or any comments, anything anybody wants to add? So we'll move on to, okay, so understanding all this, how should we treat degenerative disc disease, right? Injections or medication are designed to decrease inflammation. Is that going to fix the disc? No, it's going to do nothing. So if I can manage pain with injections and medication, or even surgery, right, over time, just because the person feels better, does that do anything to protect them and increase the health of their nerves and increase their quality of their life? Like, they're still going to be, it's not even going to touch the disability thing. It's not going to make any change to any of that stuff, right? Another option is just to live with it, tolerate it. I mean, and how many times do we have somebody come in and they actually think that that's the solution? Like, how many people come in and they say, oh, I know I have a herniation, I know I have a damaged disc, I know this and that, but you know what, I just live with it. I mean, and we've all heard that, right? If you've done a new patient exam, you've absolutely heard that. So that is absolutely an option, right? The next thing is PT. So PT, like, the idea is if we can localize where the inflammation is building, then if we can create as much movement through stretching and exercise and massage and electrical stim, ice, heat, all these different things, we can get inflammation down a lot more conservatively than injections and medication. So it's healthier for you than that. I'd agree, right? But the problem with that is that I wrote on here active and passive motion so I can remember that with active motion, like, all the protection around your spine tightens up. Like, all your girdle muscles, all your core. When we're moving, your body wants to protect your nerves, your discs. It doesn't want you to have a spinal injury just from running or whatever, you know? So with active motion, you can't even stretch directly to a disc. It's impossible. You can't get to a disc, you know? So yes, you could have scar tissue forming in the muscles and you can loosen that stuff up and maybe you can help with degeneration that way, but you're not gonna directly get to a disc. Inversion table, the same thing. Static traction is actually more stress on a disc. But think about this. Like, if you've ever had an ankle sprain, like, one of the things that you do for an ankle sprain is, or if you don't know, you should do this. When you sleep at night, you elevate your leg. Because what's happening is you're using gravity to send all that fluid back to your heart for circulation to help it heal. The idea of the inversion table is the same thing. You've got inflamed nerves in your low back, you flip upside down, you get some of that inflammation to flush back to your heart, you're gonna feel better. And a lot of people that use inversion tables, they say it helps them, you know? So I'm not saying it's not gonna help them feel better, but long term, it actually causes more stress because one, you're not designed to hang upside down, right? And then one, like all your ligaments are designed to help hold things together, not necessarily keep things from separating apart. There are ligaments that do that, but when you look through there, there's another section on ligaments. There's significantly less ligaments that help keep joints from separating than from compression or shear stresses. But bracing and pillows again, right? How many times have we heard patients come in and say, "Oh, my neck, this and that, but I got this pillow, and now I'm better," or "I got this mattress," or that. You're still treating a symptom. That's all it is. Like, you know, that's what it is. It's not fixing it. So, but now think about what we do, right? Think about chiropractic. Chiropractic separates joints that we know are attached by ligaments that have scar tissue in them. If you're frequently adjusting somebody, does motion in a joint increase or decrease? Increases, right? Okay. And this is technically a passive motion. We can actually get to the disc with an adjustment. This is actually, because what's happening, because we have an outside, whenever I stretch, I can't stretch to my disc because I have reflexes that tell me I've gone too far, so my body shuts down, right? You bring somebody in, an outside person, Dr. Gonzalez adjusts me, he don't have a reflex to tell his brain he's going too far. And he's highly trained at moving these joints. So does it make sense that we can get through that active range and actually get directly to a disc? And it's going to increase motion, it's going to decrease inflammation, it's going to help break down scar tissue, right? Decompression. There's all the research behind it. You know, what you're doing, you're opening and closing the joint, you're stimulating circulation that's been lost in the joint. If you increase those stresses over time, you are going to rebuild movement in the joint. Everybody would agree with that, right? Shockwave therapy, PEMF therapy, specifically shockwave therapy it's directly designed to break up scar tissue. That's its function, right? Break up scar tissue, increase circulation. And then, I'll come back to this. But as far as that, do we feel a little better about what we do? like does all this stuff not just make perfect sense, right? So the other thing that we can talk about, how should we treat, right? So the last two things I wrote on here, screening and education, right? Like, if we're here to help our community, should we not be screening as many people as possible when we know these facts here, that everybody's gonna get it, and no other doctor, no other provider is gonna treat it the best way possible, but we have this magic solution? Should we not be screening as many people as possible? Absolutely. It's a moral obligation when you understand this stuff. And then, so that's V1, right? That's what the V1 is about. The V1 is about getting a healthy screening, talking to them a little bit, educating them, just trying to plant a seed to where they want to know, well, maybe there's more that can be done, right? And then the V2 is all about education. Alexis, how much of this stuff do I talk to patients on a V2? All of it. You see what and then when a patient gets this, are they not happy to pay for care, right? Spouse doesn't care. Everybody when people get this.
Unless they don't care about their health or about themselves.
But if they don't care about their health or themselves, it's that they didn't get something in all of this. And then that goes back to, it's my fault. I didn't communicate something well enough for them to get it. Because it's very hard. When's the last time you heard a patient tell me, "Nah, I don't want to do that"?
Not you. Yeah, no.
It might come down to it might come down to paying for it, which is cool. Like, I might have a patient that's just like, I just can't afford it, but at least I preach my message, right? At least they get this, right? That's all I can do. I can't force people to buy something from me. I can't sell something on somebody. All I can do is educate them on this stuff, and I think everybody gets it, man. I don't think that there's not one doctor in the world that wouldn't. If I explain this to them this way, they're gonna say, "Dude, you're right, man." And I know that because I've talked to MDs, dentists, nurses. Like, we get everybody in here, you know. And then and it's cool because when you talk to somebody in the medical profession and you start talking about this stuff, they're more invested in it because they know how right I am about this stuff. And they see it. When I talk about all this stuff, they're the first ones, nurses are the first ones to say, I don't want medication. Like, I don't want to do that. I don't want surgery. It's like, a lot of them feel like doctors generally don't care because that's what they've been part of it. But anyway, today's point, the purpose of today's meeting was like, this is and that's funny that Alexa said every single time, because this is in my head 100% of the time. So I just want you guys to understand my purpose and my mission and where I'm coming from, because I think it makes perfect sense, and I think it makes perfect sense for everybody. And when you go about approaching what we do this way, I think it's just fluid. It's just easy. Your V1's going to be better. Your V2's going to be better. Treatment is going to be better. Like when this is in the back of your mind. So every question that a patient has about why am I doing this? Why do I need to do this? The answer's in here, you know? And I saw, most of y'all took a picture, which is cool, because y'all should probably go back and read through this and look through it and really read through this and try to understand the stuff that's in here. But any questions, thoughts, concerns, anything about anything? Just helpful for everybody? I think this will help. And the reason why I felt like I needed to talk about this is because, again, Alexis will tell me yes or no. When I